Good afternoon, I'm Dr. Elligan. I'm a clinical psychologist based out of Chicago, Illinois, and this is Everyday Psychology. Today we're going to be speaking about depression. What is depression? How would you know if you may be suffering from some of the symptoms of depression? Depression is, and mental health, thought to be like the common cold. Many people, some reports say up to 18% of the general population experiences some symptoms significant enough to be diagnosed as major depressive disorder at some point in their life. So, very common disorder. We want to speak a little bit about what it is and possibly about some of the treatments and ways of managing depression. So depression is an emotional state of intense negative thoughts and intense sadness, oftentimes associated with some behavioral withdrawal, meaning people socially isolate themselves. And when it affects the way the person is thinking, so they have these negative thoughts, it affects their feelings, they have this intense sadness, and it affects their behavior. They socially withdraw from other people. We begin to question, are the symptoms significant enough to be diagnosed with major depressive disorder? For major depressive disorder, in addition to this cognitive, emotional, and behavioral aspect of depression, the symptoms have to be intense and significant enough and last for at least 2 weeks for the person to be diagnosed. There's a milder form of major depressive disorder referred to as dysthymic disorder, where the person experiences everything that we just spoke about, but to a milder degree, and they're able to continue to function. And these symptoms have to be present for at least 2 years, actually, before the person can be diagnosed. With major depressive disorder, the intensity is to the level where the person actually becomes immobilized. So people who are suffering from major depression may have difficulty getting out of the bed. They have difficulty with their activities of daily living, which includes washing their clothes and themselves, paying bills, meeting daily expectations, going to the grocery store. They withdraw from all of these activities. So major depressive disorder, very debilitating. Dysthymia, a bit milder, but still very troubling for people who are experiencing it. So in review, major depressive disorder is a disorder in which a person is experiencing intense sadness, a lot of negative thoughts, and some behavioral withdrawal. It affects the person's thinking in that oftentimes they have pessimistic thoughts, they may have some poor concentration, difficulty focusing, difficulty maintaining attention. They oftentimes are very self-critical, and they may even have some suicidal ideations, which are thoughts of suicide. It affects their emotions in that they tend to be very sad. They can be melancholic. They may feel like they're in despair, and they may feel hopeless or helpless. It affects their behavior through social withdrawal and removing themselves from some of the things that they oftentimes enjoyed doing prior to being diagnosed. So they oftentimes won't go to parties, they won't engage in social activities with friends. They just withdraw, remove themselves from these activities. And it can also have an effect on their physiology. So we see appetite change oftentimes with people who are suffering from major depression. They may lose their appetite, or their appetite may increase and they may start overeating. We oftentimes also see some sleep disturbances. So the person may have hypersomnia, where they're sleeping for extended periods of time, or insomnia, where they're having difficulty maintaining sleep because they keep waking. So this is major depressive disorder. A variety of different treatments to help people who are suffering from major depressive disorder or dysthymia. Those treatments may include cognitive behavioral therapy, which is a form of psychotherapy that focuses on changing the person's cognitions or ways of thinking, and also modifying their behavior and encouraging them to re-engage with things that they enjoyed doing in the past, which they've stopped doing. And there are other forms of psychotherapy that may also be helpful, but a very common one that has been found to be very successful is cognitive behavioral therapy. And then in very severe cases, the person may also have to supplement psychotherapy with psychopharmacology or medication, and a variety of different antidepressant medications that have been found to be very, very helpful in helping people manage some of the symptoms of major depressive disorder and or dysthymia. I'm Dr. Elligan, and this is Everyday Psychology.